Swastiastu, we are from Group B6 and we will present our student project about congenital hemolytic anemia. Now we will present the introduction to the first presenter in charge. You may start.
Greetings, my name is Arianda Bella Maitri Anjasrini with the three last digit of student ID number 188. So here I'll be explaining about the background of this paper. So congenital hemolytic anemia are a group of disorder affecting intrinsic red blood cells that share clinical and laboratory characteristics related to decrease in RBC lifespan. Hemolytic anemia is a rare but a highly heterogeneous inherited genetic disease that occurs as a consequence of the early breakdown of red blood cells, which can be attributed to acquired or congenital irregularities in hemoglobin, proteins in the red blood cell membrane, or essential enzyme involved in RBC metabolism. Some common types of congenital hemolytic anemia include hereditary spherocytosis, hereditary elliptocytosis, and thalassemia. Prevalence may differ across various geographical regions and ethnic groups. Symptoms of congenital hemolytic anemia typically manifest in infancy or early childhood, but in the milder instances, they may go unnoticed and undiagnosed until adulthood. In the later stages of life, the clinical symptoms of congenital hemolytic anemia are primarily due to ongoing managed hemolysis and are mostly associated with anemia. This anemia is typically mild to moderate and it's characterized by fatigue and paleness. It is often accompanied by jaundice and enlarged spleen or splenomegaly and a high reticulocyte count. Since this is an inherited disease, a high index of suspicion is necessary in order to obtain an early diagnosis. And for the problem formulations for this paper is what is the definitions of congenital hemolytic anemia, what is the epidemiology, etiology, and pathophysiology of congenital hemolytic anemia, how is the evaluations for persons suspected with hemolytic anemia, what is the differential diagnosis and complications of congenital hemolytic anemia, and what is the treatment and management of congenital hemolytic anemia. And for the next slide will be presented by my friend. Thank you.
I'm Angelika Fornangawan with the last three student digit number 092. The objectives of this paper are to describe the definition of congenital hemolytic anemia and also explain its epidemiology, etiology, signs, symptoms, evaluation, differential diagnosis, treatment, and management. There is theoretical benefit of this paper. This paper can be used to increase knowledge about congenital hemolytic anemia, its epidemiology, etiology, evaluation, signs, and symptoms. In addition, it can add insight about the differential diagnosis, treatment, and management of congenital hemolytic anemia theoretically. There is also a practical benefit for readers. This paper are being a source of information regarding congenital hemolytic anemia. For writers, it's to increase the experience and knowledge in writing scientific works. For academic institutions, it can be used as a reference to develop knowledge about congenital hemolytic anemia.
Let me explain about CHA. So CHA is abbreviation of congenital hemolytic anemia. So it is a rare hereditary abnormality in red blood cells. It is characterized by anemia, reduced erythrocyte lifespan, jaundice, splenomegaly, and hemolysis. So CHA has three groups, right? We will later discuss the pathophysiology of each group, but let me provide you some examples. So the example of defects of membrane protein is hereditary spherocytosis, hereditary stomatocytosis, and hereditary elliptosis. On the other hand, the most common examples of enzyme deficiencies are G6PD deficiency and pyruvate kinase or PK deficiency. Lastly, thalassemia is one of the most well-known example of hemoglobin defect.
My name is Putu Nadia Anita Prasanti and my last three-digit number is 150. Congenital hemolytic anemia global epidemiology varies due to factors like type and genetics. Hereditary spherocytosis is the most prevalent form of congenital hemolytic anemia in Caucasians, with prevalent range ranging from 1 in 2,000 and 1 in 5,000 individuals, and follows an autosomal dominant inheritance pattern about 75%. Then, second is hereditary elliptocytosis. This is more common in West Africa and most cases are asymptomatic, but 10% may have moderate to severe anemia. Third is pyruvate kinase deficiency. It's the predominant non-spherocytic congenital hemolytic anemia with an estimated prevalence of 3 to 8 cases per 1 million individuals, resulting from autosomal recessive variation in the PKLR gene. And the last one is thalassemia and sickle cell anemia. These are endemic in southern Turkey, with prevalent rates for thalassemia beta is 1.84 to 0.3% and sickle hemoglobin is 4.6%. Congenital hemolytic anemia is less common in the Asian population, ranging from 1 in 5,000 individuals. Some African and American people exhibit hematological difference, possibly associated to a higher frequency of thalassemia alpha and J6PD enzyme deficiency in population with darker skin.
Hello everyone, my name is Nimade Aprilia Dwisyanti with 3 last digits of student number 229. I will explain about the etiology. Hemolytic anemia has a wide range of causes, which can be further classified as immune-mediated or non-immune-mediated, intravascular or extravascular, inherited or acquired, and intracorpuscular or extracorpuscular. Defects in RBC metabolism can also result in congenital hemolytic anemia by impacting one of the 3 primary metabolic pathways such as glycolysis, nucleotide metabolism, or the exos monophosphation. RBCs are known to be destroyed by infections like malaria and babesiosis, as well as by drugs like dapsone, which may be utilized to treat this illness but has the potential to cause oxidative damage. That's all about the etiology. Thank you.
First of all, my name is Devalenza Ramadan with last number 016. The pathophysiology of congenital hemolytic anemia is differentiated as 3 types, such as first, membrane defects. Conditions such as hereditary spherocytosis and hereditary elliptocytosis result from genetic mutation that influence the structure of protein, like spectin or other membrane components. Second, enzymatic defects. Certain congenital hemolytic anemias are associated with enzyme deficiencies. For instance, glucose 6-phosphate dehydrogenase. Deficiency involves the enzyme responsible for safeguarding red blood cell from oxidative damage. Third, hemoglobin defects. Congenital hemolytic anemias resulting from hemoglobin chain defects are a subset of inherited blood disorder where genetic mutation affect the structure of and function of one of the globin chains in hemoglobin.
Greetings, doctor. My name is Janice Graldingen with the last 3 digit number 119, and I'm going to explain about the sign and symptoms of CHA. So, CHA in mild to moderate degree often remains undiagnosed as it usually appears as late onset. The clinical presentations include fatigue and pallor as associated with jaundice, splenomegaly, and high reticulocyte count. The most common neonatal clinical presentations of CHA is jaundice, whereas anemia, splenomegaly, etc. often appear in infancy. Furthermore, it is often underdiagnosed and misdiagnosed as an idiopathic jaundice. Hyperbilirubinemia is usually expected with a certain proportion in newborns. However, patients with CHA often experience distinguished onset and the time in which the bilirubin peaks. At the baseline, CHA can be simply compensated, bringing about mild to moderate anemia by increasing reticulocytosis. However, other concerning events may occur as a presentation of severe CHA, like oxidative stress, kernicterus, and aplastic events. That's all from me. Thank you.
Greetings, doctor. My name is Gabrielle from Restafita with my last 3 digits and the number being 118, and today I'll be presenting about the evaluation of congenital hemolytic anemia. When hemolysis anemia is suspected, a more detailed diagnostic approach needs to be carried out. Apart from focusing on current symptoms, the patient's history and physical examination also hold an important role. As congenital hemolytic anemia is an inherited disorder, it is best to know the patient's family history, such as thalassemia, G6PD deficiency, sickle cell anemia, and many more. Their personal history of pre-existing disease that potentially exacerbates the symptoms could also help for further evaluations of CHAs. History of medications, ethnic, and racial background of the patient should also be observed. Symptoms usually appear during infancy in the form of kernicterus or idiopathic jaundice, which later in life, the clinical presentation mostly related to anemia along with jaundice, formation of pigment gallstones like ulcers and splenomegaly. Although the patient presents with physical characteristics that could help the clinician in diagnosing the condition, lab examinations are still the key. It begins with a complete blood count indicating normocytic anemia, manifestation of reticulocytosis, increased level of lactate dehydrogenase, elevation of unconjugated bilirubin, and low level of hepatoglobin. Peripheral blood smear and direct antiglobulin tests should also be performed in order to identify the specific etiology of CHAs. That would be all from me. Thank you.
Thank you for the time. My name is Sarah Putri Bungaran with 078 as the last three digits of my student number, and this time I'll explain about the treatment and management of congenital hemolytic anemia. Treatment for congenital hemolytic anemia depends on its severity. Immediate interventions such as blood transfusion, plasmapheresis, diuresis will be done considering the cause of congenital hemolytic anemia itself. When severe anemia occurs, blood transfusion is needed for mainstay, especially if bleeding occurs. Management of neonatal jaundice is phototherapy and exchange transfusion. Most neonates with congenital hemolytic anemia require red blood cell transfusion, especially in their first year of life. Congenital hemolytic anemia is caused by a hereditary disorder. The most common hemolytic anemia is hemolytic anemia caused by hemoglobinopathy. The most common disease due to this is thalassemia. Individuals with thalassemia may experience mild anemia for the rest of their lives. They live like normal people but need regular monitoring and blood transfusion when necessary. And that's all from me. The next will be continued by my colleague. Thank you.
Let me introduce myself. My name is Samantha Petra Theobald with last three student numbers 108. For the differential diagnosis, the diagnosis of congenital hemolytic anemia is made by combination of anamnesis, clinical examination, and laboratorium tests. The presence of hemorrhage, which cause sudden drop of red blood cell in clinical evaluation, might be a sign of anemia due to blood loss or acute anemia. Blood loss anemia also presents elevation of reticulocyte count on the laboratorium test as the result of bone marrow compensation for the red blood cell loss. Diagnosis of congenital hemolytic anemia should be confirmed by evaluation of patient history and other laboratory test results, such as LDH, hepatoglobin, and indirect bilirubin. The cause of hemolysis should be found, whether it is hereditary or acquired, and immune or non-immune. COM test or indirect antiglobulin test or DAT is used to confirm autoimmune hemolytic anemia, which is causally different from congenital hemolytic anemia. There are some rare cases of paroxysmal nocturnal hemoglobin, which presents hemolysis due to blood transfusion or circulatory suppurative mechanism. In this condition, there are some case reports which help distinguish intravascular hemolysis from other diseases, such as PNH and heart valves with mechanical support. The presence of kidney injury is more visible on those diseases compared to the intravascular hemolysis unless some kidney disease is found.
Hello, my name is Kadek Bintang Aristia Putri with my zero digit of my student number is 056, and I'll explain about the complications of congenital hemolytic anemia. In sickle cell disease is a chronic hemolytic anemia that can cause reductions in oxygen transport capacity resulting in tissue hypoxia, which is characterized by clinical manifestations such as fatigue. Patients with SCD will require blood transfusions, pain, crisis, and other organ damage. Toxic effects of circulating free hemoglobin and iron in hemolytic anemia may also cause complications such as ischemia and thrombotic, and one of it is paroxysmal nocturnal hemoglobinuria. Intravascular hemolysis can lead to acute kidney injury as a result of increased destructions of erythrocytes, release of free hemoglobin and iron. Hereditary spherocytosis is also related to hemolytic anemia due to an abnormal red cells membrane and classifies as type of congenital hemolytic anemia that often have cholelithiasis as one of the most common complications. That's all from me, and the next slide will be presented by my friend. Thank you.
So hello everyone, my name is Adelia Pramesti with my last three-digit number is 165. So the conclusion is, congenital hemolytic anemia is a condition where the red blood structure has abnormalities and is characterized by short lifespan. The epidemiology is distributed according to type, genetics, and specific populations. The causes can be classified into immune-mediated, non-immune-mediated, intravascular, extravascular, inherited, acquired, intracorpuscular, and extracorpuscular. According to the classification, congenital hemolytic anemia has three main pathophysiology that causes red blood cells abnormalities, such as membrane defects, which cause genetic mutation that change the protein structure, enzymatic defects which cause red blood cells to undergo hemolysis easily, and hemoglobin defects which mutate genes so that the production of globin genes becomes abnormal. In carrying out the evaluation, anamnesis and physical examination need to be done properly, especially asking things related to the family history of this disease or other relevant disease. Also, laboratory examination need to be carried out too, to find anemia as well as other signs related to red blood cells damage. In the process of establishing a diagnosis, several other diagnoses can be made possible, such as autoimmune hemolytic anemia, paroxysmal nocturnal hemoglobinuria, and intravascular hemolysis. Congenital hemolytic anemia itself has symptoms of jaundice, splenomegaly, and pallor. Also complications such as heart enlargement, ischemia, thrombosis, kidney disorders, and cholelithiasis. If there is an established diagnosis of congenital hemolytic anemia, the patient can be treated with blood transfusion or phototherapy, especially on neonates. And so the next one is about the advice. Understanding congenital hemolytic anemia is important for professionals, especially knowing about the signs, symptoms, evaluation, differential diagnosis, treatment, and management. Also for the families in related that congenital hemolytic anemia is hereditary. Related that this condition is congenital, and also even congenital hemolytic anemia is now easily detected when adulthood. Early detection in neonates is vital to lowering the risk of complications.
We have come to the end of our group presentation. Thank you for the attention. Para Mas Santi, Om Santi 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 Om.